A silent threat. 12 signs that could indicate stroke risk. Stroke risk, medically known as cerebrovascular accident risk, is a serious health concern that can lead to debilitating or even fatal outcomes. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. This can happen due to a blocked artery, known as an ischemic stroke, or the leaking or bursting of a blood vessel, known as a hemorrhagic stroke. Risk factors for stroke include high blood pressure, tobacco use, diabetes, high cholesterol, poor diet, physical inactivity, and obesity. Additionally, personal or family history of stroke, age over 55, and conditions like heart disease, atrial fibrillation, and sleep apnea increase the risk. Alarmingly, stroke is the second leading cause of death worldwide and a leading cause of disability. In the United States alone, someone has a stroke every 40 seconds, and every 4 minutes, someone dies from stroke. Recognizing the signs of stroke risk is critical for prevention and early intervention. Symptoms of a potential stroke include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking, or difficulty understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, or lack of coordination, and a sudden, severe headache with no known cause. It's important to note that stroke symptoms can vary widely depending on the part of the brain affected and the extent of the damage. Early detection and treatment can significantly improve outcomes, making it crucial to be aware of these signs and seek medical attention promptly if they occur. To address this crucial health issue, I will outline the top 12 signs of stroke risk in today's video, empowering you to recognize and take action against this silent threat. First, the sudden onset of numbness or weakness in the face, arm, or leg, particularly on one side of the body, is a classic sign of stroke risk. This symptom results from the disruption of blood flow to the part of the brain that controls these areas. When a stroke occurs, cells in the affected brain region quickly begin to die due to lack of oxygen, leading to the loss of function in the corresponding body parts. The severity and duration of this numbness or weakness can vary, but it's typically a sudden and noticeable change. It's crucial to recognize this sign, as immediate medical attention can make a significant difference in recovery and outcome. Secondly, confusion or trouble speaking and understanding speech can indicate a stroke risk. This happens when the stroke affects the language areas of the brain, hindering communication and comprehension abilities. You might notice sudden difficulty in forming coherent sentences, finding words, or understanding what others are saying. In some cases, speech might become slurred or completely unintelligible. This symptom highlights the importance of quick action, as early treatment can help minimize long-term language impairments. Third, vision problems in one or both eyes can signal stroke risk. A stroke can disrupt the visual pathways in the brain, leading to blurred vision, double vision, or a sudden loss of vision. This might manifest as trouble reading, recognizing faces, or navigating through space. Vision changes due to stroke are often abrupt and can be temporary or permanent, depending on the extent of the damage and the speed of treatment. Next, experiencing difficulty with walking, dizziness, loss of balance, or unexplained coordination problems could also point to stroke risk. These symptoms occur when a stroke impacts the parts of the brain responsible for motor control and balance. You might find yourself suddenly stumbling, unable to walk in a straight line, or feeling vertigo or dizziness. It's critical to take these signs seriously, as they can lead to dangerous falls and further complications. Fifth, A sudden, severe headache with no known cause is another warning sign of stroke risk. This kind of headache is often described as the worst headache of one's life and can be accompanied by vomiting, altered consciousness, or neck stiffness. This symptom is particularly characteristic of hemorrhagic strokes, where a blood vessel ruptures, causing bleeding in or around the brain. Quick medical evaluation is essential in such cases, as hemorrhagic strokes require immediate intervention. Furthermore, a lesser-known sign is the sudden appearance of facial droop or an uneven smile. When a stroke occurs, the facial muscles may weaken or become paralyzed on one side, leading to a noticeable asymmetry in facial expressions. This can be easily checked by asking the person to smile or show their teeth. If one side of the face does not move as well as the other, this could be a sign of stroke, necessitating prompt medical attention. 7th, experiencing sudden limb paralysis is a critical sign of stroke risk. This symptom can manifest as a complete inability to move an arm, leg, or even an entire side of the body. It's caused by the interruption of blood flow to the brain regions that control voluntary muscle movements. The paralysis is often one-sided, reflecting the brain hemisphere affected by the stroke. Quick action is essential in such cases because the longer the brain is deprived of blood, the greater the risk of permanent damage. 8th, a sudden onset of difficulty swallowing, medically known as dysphagia, can be a sign of stroke risk. This occurs when the stroke affects the part of the brain responsible for the coordination of the muscles and reflexes involved in swallowing. Difficulty swallowing can pose a significant risk of choking or aspiration, where food or liquid enters the airway. It's an important symptom to recognize, as addressing it quickly can prevent complications like pneumonia. 9th, experiencing a sudden loss of coordination or clumsiness can be indicative of a stroke. This may manifest as an inability to coordinate movements, dropping things, or difficulty performing tasks that require fine motor skills. This happens when a stroke disrupts the cerebellum or other parts of the brain that regulate coordination. Prompt medical attention is vital, as early treatment can help minimize long-term effects. 10th, experiencing unexplained and severe fatigue or an overwhelming sense of exhaustion can also be a sign of stroke risk. While fatigue is a common symptom in many conditions, its sudden and intense onset, especially when combined with other stroke symptoms, should not be ignored. A stroke can affect areas of the brain that regulate energy levels and consciousness, leading to fatigue. 11th, a sudden change in mental status, such as confusion, disorientation, or a sudden decline in cognitive function, can be a sign of stroke. This may include difficulty with memory, spatial orientation, or problem solving. Strokes that affect the frontal lobe or other areas involved in cognition can cause these symptoms. Immediate medical evaluation is crucial, as these symptoms can progress rapidly. Lastly, a sudden onset of emotional changes or unusual behaviors, such as uncharacteristic agitation, weeping, or laughing, can indicate a stroke. These symptoms may occur when a stroke affects the parts of the brain that control emotions and behavior. Such changes can be distressing to both the individual and their loved ones and require prompt medical attention. If you experience any of these symptoms, it's imperative to contact a healthcare professional and request a magnetic resonance imaging (MRI) scan. An MRI is an advanced imaging technique that uses magnetic fields and radio waves to create detailed images of the brain and blood vessels. This test is particularly effective in detecting strokes, as it can reveal areas of the brain that have been damaged by a lack of blood flow or bleeding. MRI scans are widely used in the United States, with millions of scans performed each year. They are crucial in diagnosing strokes, assessing the extent of brain damage, and guiding treatment decisions. The MRI scan can show not only the presence of a stroke but also its type, whether it's an ischemic stroke caused by a blood clot or a hemorrhagic stroke caused by bleeding in the brain. This information is vital for determining the appropriate treatment, which can vary significantly depending on the type of stroke. Although strokes can be life-threatening and lead to long-term disabilities, many people recover significantly with proper treatment and rehabilitation. The likelihood of recovery depends on the stroke's severity, the affected brain area, and how quickly treatment begins. The good news is that medical advancements have significantly improved stroke treatment and recovery outcomes. To address stroke risk, let's explore 8 lifestyle modifications that can reduce the risk and promote better overall brain health. Incorporating regular physical activity into your daily routine is a key measure in reducing stroke risk. Engaging in activities like brisk walking, cycling, or swimming for at least 150 minutes per week can significantly lower blood pressure, improve cholesterol levels, and help maintain a healthy weight. Exercise not only reduces the risk of stroke but also strengthens the heart and lungs, enhancing overall health and vitality. Adopting a heart-healthy diet is essential in mitigating the risk of stroke. A diet rich in fruits, vegetables, whole grains, and lean proteins, and low in saturated and trans fats, can drastically improve cardiovascular health. Such a diet not only aids in stroke prevention but also supports a healthy digestive system and helps in maintaining stable energy levels throughout the day. Monitoring and managing blood pressure is a critical aspect of stroke prevention. High blood pressure is a major risk factor, and maintaining it within a healthy range can be achieved through lifestyle changes and medication. Regular blood pressure monitoring, combined with a balanced diet and stress management, can lead to significant improvements in heart health. Keeping cholesterol and triglyceride levels in check is crucial for preventing strokes. High cholesterol can lead to artery blockages, increasing stroke risk. Through dietary adjustments, increased physical activity, and medication if necessary, maintaining healthy cholesterol levels not only reduces stroke risk but also enhances overall arterial health. Moderating alcohol consumption is important for stroke prevention. Limiting alcohol intake can significantly reduce the risk of high blood pressure and irregular heart rhythms, both of which are stroke risk factors. Responsible alcohol consumption, coupled with a healthy lifestyle, contributes to better cardiovascular health and general well-being. Quitting smoking is a vital change for reducing stroke risk. Smoking contributes to the formation of clots and arterial damage, leading to strokes. The benefits of quitting smoking extend beyond stroke prevention, including improved respiratory function and a general increase in life expectancy. Effective diabetes management is key in reducing stroke risk. Diabetes can lead to blood vessel damage, increasing the risk of stroke. Controlling blood sugar through diet, exercise, and medication not only prevents strokes but also helps in maintaining overall metabolic health and preventing other diabetes-related complications. Ensuring adequate sleep and managing stress are important for lowering stroke risk. Chronic lack of sleep and high stress can negatively impact heart health. Adopting healthy sleep habits and stress reduction techniques like meditation or yoga not only decreases the risk of stroke but also improves mental clarity and emotional stability, leading to a more balanced and fulfilling life. Strokes can have far-reaching consequences if not promptly treated. Delayed or inadequate treatment can lead to permanent neurological damage, physical disabilities, and even death. It's also worth noting that some conditions may present symptoms similar to those of a stroke, such as migraines, brain tumors, or seizures. Therefore, accurate diagnosis and timely intervention are crucial. Advancements in technology and medicine have significantly improved the detection and treatment of strokes. Today, treatments like clot-busting drugs, thrombolytics, and surgical procedures to remove blockages or repair bleeding in the brain are commonly used. These interventions, coupled with rapid emergency response, have greatly increased survival rates and reduced the severity of long-term disabilities in stroke patients. Historically, stroke treatment was limited and less effective. In the past, options were often restricted to supportive care and rehabilitation, with little ability to address the underlying causes of the stroke. For instance, before the advent of advanced imaging techniques, diagnosing the type of stroke or the exact location of a brain lesion was challenging. Treatments like bloodletting, which were based on less scientific understanding, were common, and outcomes were generally poor. Today, we are fortunate to have access to sophisticated medical technologies and a deeper understanding of stroke pathology. MRI and CT scans allow for quick and accurate diagnosis, and treatments are more effective and targeted. Public awareness campaigns have also played a crucial role in educating people about the signs of stroke and the importance of immediate medical attention. In conclusion, while stroke remains a serious health threat, the advancements in medical technology, knowledge, and treatment options available today offer much hope. It's essential to stay informed about stroke risks and symptoms, and to seek prompt medical care if a stroke is suspected. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.